Hi everyone, it's Jobs here and welcome back to my channel. In today's video, we are going to understand a very important and highly researched topic in science, known as diabetes. Diabetes is a lifelong disease that causes hyperglycemia, which means high blood sugar levels. You might be wondering, why is this a problem? Well, excess untreated blood sugar levels can result in cardiovascular diseases, kidney damage and failure, bone and joint problems, and nerve damages. There are two major types of diabetes. Type 2 is known to be the most common form. Instead, type 1 is the rare form. Now, let's explore the two types of diabetes in more detail. But before we do that, please remember to like this video and hit the subscribe button. Let's begin with the rare type of diabetes. Type 1 currently affects 400,000 people in the UK. The disease often begins in childhood, and it is the result of an autoimmune condition. The immune system, which normally should protect you, attacks the beta cells within your pancreas. These beta cells produce a hormone called insulin. This hormone regulates blood sugar levels by triggering glucose absorption by cells after a sugar carbohydrate containing meal. After the attack from the immune cells, the amount of beta cells in the pancreas get reduced and then completely lost. Reason why insulin production decreases drastically, then becoming absent later on. The real question is, why is the immune system doing that? Extensive research is taking place to have a detailed answer, but what is known so far is that a combination of genetic predisposition mixed with environmental factors are responsible for this behavior. Let's dive into diabetes type 2. This common form of diabetes affects around 4.9 million people only in the UK. And unlike type 1, here your lifestyle has a big impact on the development of the disease. Here, abnormalities with insulin remains the problem. But this is not caused by an autoimmune disorder, but rather is the occurrence of two major factors. The first is the inability of beta cells in the pancreas to provide enough insulin. The second is insulin resistance from muscle and liver cells. Therefore, your muscle and liver cells are not reacting to the command of insulin communicating to absorb glucose from the circulating blood. If you have watched my previous video in glycogen synthesis, you know that glucose is stored mainly in muscle and liver tissue. Thus, insulin resistance leads to an inability of storing glucose. It is important to know that beta cells in the pancreas tend to release more insulin to fight insulin resistance, but this is still not sufficient in diabetes. Major risk factors of diabetes type 2 are family history, race and ethnicity. This is due to genetic, environmental, and biochemical factors. In fact, people with close family members and South Asians, Black Africans are at higher risks to develop insulin resistance. Obesity is another important factor, and this is due to increased amount of non-esterified fatty acid, glycerol, hormones, cytokines, inflammatory markers, all playing their part in the development of insulin resistance. Age is another important aspect. It has been observed that after the age of 45, the risk increases. Another important factor affecting females is polycystic ovary syndrome, which is a common condition in females. Now let's observe the symptoms. For both types of diabetes, symptoms are fairly similar, and they include increased thirst and hunger, fatigue and frequent urination, blurred vision, and weight loss. The difference between type 1 and 2 lies in the time in which symptoms tend to appear. In fact, diabetes type 1 is characterized by sudden appearance of symptoms, whereas in diabetes type 2, they take relatively more. So how diabetes is diagnosed? Both types of diabetes are diagnosed through blood tests. The analysis of your blood sample would determine your blood sugar level. Diabetes is diagnosed when a blood sugar test at random times result in 200 mg per deciliter or 11.1 millimoles per liter, or fasting blood sugar result in 100 to 125 mg per deciliter or 5.6 millimole per liter to 6.9 millimole per liter, which indicates prediabetes. Instead, 126 mg per deciliter and 7 millimole or higher indicates diabetes. If the test results suggest diabetes, the doctor might request further tests. This could include tests to detect the presence of autoantibodies responsible for beta cell dysfunction in type 1. In terms of treatments, unfortunately, there is no ultimate cure for diabetes. Current treatments differ depending on the type of diabetes, and they are there to prevent serious life-threatening complications. For type 1 diabetes, lifestyle and dietary changes are required to be tightly regulated, alongside the intake of insulin medications. This because insulin is completely absent in type 1. It is important here to emphasize on lifestyle and dietary changes, as carbohydrate, fat, and protein content must be counted. Regular exercise and blood sugar must be monitored. This has to be constant to prevent both hyperglycemia and hypoglycemia, which is low blood sugar levels, and that can be caused by too much insulin uptake, insufficient carbohydrate in the meal, or too much physical activity. On the other hand, type 2 diabetes has more room for different types of solutions. This because this type of diabetes insulin content is not absent like type 1. Therefore, with well-monitored diet and glucose levels, as well as exercise, it is possible to control the disease even without medication for some individuals. Also, a wide variety of medication is available, where metformin is the most common as it does not lead to a possible hypoglycemic event like other type of medications. Metformin acts on lowering blood glucose production in the liver and improves body's sensitivity to insulin. To finish with, there are other types of very rare forms of diabetes, as important as the two types explained in this video. These include maturity onset diabetes of the young, neonatal diabetes, Wolfram syndrome, cystic fibrosis diabetes, type 3C diabetes, latent autoimmune diabetes in adults. But all of these are going to be explained in another video. I hope you enjoyed and learned a bit more about diabetes from this video. If you did, please leave a thumbs up and subscribe to the channel. And feel free to share this video with friends and family that might need to take care of their blood sugar levels. Thank you and see you in the next video.